Hello, hello, and welcome to the Baker Seniors Show. This show is all about Medicare and what it can do for you and how you can get involved, how you can get covered. We need to be sure that we are covered with our health care before we get sick, before things go on, before we go into the hospital. We need to make sure that we have the right plans. And here to tell us all about it is Mr. Steve Baker. Hello, Steve.
Hello. Great. Glad to be here.
It's it's really great that you're taking the time out of your day to answer the questions that people have about Medicare.
Mhm.
And I know because you've been in this for so many years and you actually are on Medicare yourself, you've experienced it with not only your customers, but also yourself, your family. You've run into a lot of different issues for people. So I know that people have questions, especially when it comes time to go into the hospital. So we're going to talk a little bit about that today. Steve, what is it that you would like us to know about the caution that you're talking about today, that you're really cautioning us, and so we're curious about what that is.
Well, everybody remembers, I guess, or if you don't remember, I'll just go over it real briefly. There's Part A, Part B, Part C, and Part D of Medicare. The Part A of Medicare, which is what we're really talking about here, and we're talking about Part A and B, but A has to do with the hospital itself, the hospital room. And I tell people all the time when I'm talking to them that just to remember that Part A is just for the hospital room only, and they don't need to be worry about it typically, especially if they happen to be checked in off the street, what I call off the street, then they will automatically go into Part A. However, about 4 years ago or so, I had an occasion to take my wife to the emergency room. And we went to the emergency room, and it's hectic. If you've ever been in one, it's just unbelievable what goes on. Those people just aren't paid enough. I'm telling you, things just happen just all the time, and it's just movement, 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 movement. People are scurrying around, and people are crying and carrying on, and just unbelievable.
Nobody wants
But
to go to the hospital, especially in an emergency.
exactly, exactly. But they're very important. The emergency room fills a need, and they're very important. So you're in the emergency room, and let's say you arrive there at 10 o'clock or something like that, or 9 o'clock or 10 o'clock in the evening, and my wife had some kind of ailments and symptoms that were just absolutely not normal. So I said, okay, we're going to the emergency room, which we did, and they let us into the emergency room and signed us a room, and the doctors were scurrying back and forth, and two or three different nurses came in with their machines and their clipboards and this and that, and 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock, how it goes. It's just one
Yikes.
one emergency comes in, and that pushes everybody down and so forth. So you're there practically all night, really. Before you really get to the bottom of it, and the physician, the emergency room physician, finally came in and said, "Well, I'll tell you, we've run some tests, da 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 da, and what I'd like to do is to check you in, send you over to the hospital and check you in for observation." So now remember that B is everything else other than the hospital. So when you go over there, and this is one thing that everybody needs to remember, if you go from the emergency room over to the hospital, and the hospital and the emergency room, people don't realize this, are different. They're two different entities.
No,
So yes,
no, I did not know
yeah.
that.
So you go over there, and effectively, since the emergency room physician ordered a room, you're effectively still in the emergency room, and the emergency room is paid for through Part B. So we spent the remainder of the evening, and the nurses come in and so forth. And I didn't realize it at that time, even though I was a Medicare agent, that she was still under B. So, and by being under B, that means that it'll be paid under B as opposed to A. So when someone goes from the emergency room into the hospital, they think they're being checked into the hospital, but they're not. They're still in the emergency room. Their A has not kicked in. Now, once you're there, someone needs to remember to remind people that you want to be checked in under A. Somebody needs to go to the desk and say, my wife needs to be checked in. Now, it's when an emergency situation and all like that, a lot of that time is overlooked, and everything is fine except if someone happen to need skilled nursing. Skilled nursing is another component of the treatment. Say, they have to have, say they have a broken leg or something like that. They check them into the hospital they're still under B, they're still in the emergency room. Once A kicks in, then everything is fine. So someone came in about mid-morning and had my wife sign a form, and I said, what is it? Let me see the form. And it said B, because she's going to be checked in. B. I knew that we were going to be checked out, so I didn't make a big issue of it. But I knew that she wouldn't be needing skilled nursing. But skilled nursing is part of A. If someone is in the hospital and they need to go to skilled nursing, then the issue is that she's not under A, and that's a huge issue. So
before you move on, can you tell us what that's covering? So let's back up, because I don't want anybody to get confused, because I'm getting there.
Okay.
All right. So you took your wife to the emergency room in the middle of the night, and you guys were there all night long, and you were covered under A at that point. She was covered under A.
No, B. She was covered under B.
Okay.
Covered under B.
And what does that cover?
B covers everything except the hospital room itself. So B is all the treatment, all the drugs, all the treatment that she gets in the emergency room is under B.
Okay.
So the emergency room physician says, I'd like to have her stay over, checked into the hospital. She's still in B. She hasn't really gone into the hospital officially. The hospital room over next door in the hospital is officially just an extension of the emergency room. So she was still under B.
Okay. Yeah. That's very helpful. Okay, so I'm taking everybody down this road with us.
Yeah. So
because you know what you're talking about.
Right.
I have to back it up. Okay.
Right. So let's back up and say that she didn't go to the emergency room. The outside doctor or whoever it is, said, I want you to go check into the hospital because I need to run a bunch of tests. So you drive up to the front, you let the patient out, park the car, come back in, you go in the front door, and they tell you where to go and all of that. So you see what happened is you bypass the emergency room. Okay. So you go check in, they take you to your room, everything's fine because you're part of A. And nothing happens unless you need, after your stay there, you need to have skilled nursing. Skilled nursing is part of A only. So the problem comes when people don't, they don't really know, of course. And I don't think, to be honest with you, a lot of the hospitals even tell them that they're under A. It's just automatically. And if they needed skilled nursing, you've got 20 days actually effective, and it can be extended to 100 days skilled nursing care as part of the hospital, and that's paid for through A. You go back, if you're under B, there is no skilled nursing. So effectively, they would have to pay for skilled nursing. It's a little trick. It's a little twist in the Medicare rules and laws that people need to understand. You just need to understand that if you're actually in a hospital room, if you've been there for whatever reason, you need to check with someone at the front desk and say, we've got A and B. This will be under A. Is that correct? Oh, yes, it will be under your A. No problem. Everything's fine. But what you don't want to be is in the hospital under B. Unless, everything would be fine. Like with my wife, it was fine because she didn't need skilled nursing. So it's just a little piece of the Medicare rules, kind of way out there. Most of the time, it'll never apply to someone, but they don't want to have a whole bunch of bills come in, and they're having to pay their own skilled nursing. You don't want that.
No, nobody wants that. So, what if when you go to the hospital, Steve, whether you're the person taking them or it's you're not really thinking about Medicare. You're not really thinking about health insurance.
Correct.
Unless you've been burned before, I guess. But you're thinking about your health. You're bleeding or you're in pain or something, some reason is taking you to the hospital.
Right.
How can you be sure? I mean, you said stop at the front desk, but what if you're bleeding and you can't stop at the front desk? Then what?
Well, if you're bleeding, then you go into the emergency room. And that only happens if the emergency room physician wants you to stay overnight for observation. So a lot of times you go in, if you're bleeding, you cut yourself and, with a knife or whatever, and it's obvious that you're going to need a lot of stitches. That's always done over the emergency room anyway. They stitch you up and send you home. So no problem with that.
So if somebody is nervous now because you're cautioning us and they're nervous next time they go to the hospital, should they call the Medicare number that you've given us, or should they call you? Or how do they check to make sure if they're not convinced that the person at the front desk told them the right information?
Yeah, they can call 1-800-Medicare and they can tell them the situation. And by the way, 1-800-Medicare is open 24/7, 24 hours, 7 days a week. So you can call Medicare and explain the situation and ask them, and someone at the desk in Medicare will be able to help you.
Okay.
That's another little trick that a lot of people don't know. And if there's any questions, call 1-800-Medicare and explain the situation.
Okay, so for those of you who are listening to this in the podcast, I want you to know that 1-800-Medicare is, and get your pen and paper out so you can write this down. I think this is important, and you should put it up on your refrigerator, put it in your pocketbook, in your wallet, wherever you think you might need it. It's 1-800-633-4227. And that's open 24 hours a day, 7 days a week for any Medicare questions that you might have. So
Exactly.
Steve, when is it that they call you?
Well, there's no need to call me because I'm the agent that provided the coverage for them. And once you go into the medical situation, you remember last week we were talking about the HIPAA laws. So I'm not allowed as an agent to interfere or have knowledge of anything that's going on. And the HIPAA laws are very they're very strong. So we have to be very careful and not get a layman like myself. I'm not a physician. I'm not anything close to that. So I really don't need to be involved in someone's treatment. But
so they should call you before they go into the hospital. They should call you when they're ready to sign up for Medicare, or if they have questions about their family member who's getting ready to. But other than that, they should call Medicare.
Sure, exactly.
Okay,
Yeah,
well, I'm going to
yeah.
put your phone number up now. This is for signing up for Medicare. If you have questions about what you're covered, not in an emergency situation, but you want to just talk to Steve about the coverage that you have or that your parents have, or if you're getting ready to go into Medicare, you want to make sure you sign up for the right um, plan. And
Hmm.
his number is 832-754-3292. That's Steve Baker. And Steve would be happy to answer any questions that you have, help you get signed up for the right Medicare plan.
Correct. Correct. Yep. So the other area that I want to talk to everyone about is the Part D plan. And the Part D plan, I'm sure most everyone knows. If you don't, I'll explain the Part D plan that has to do with the medications and prescriptions. It's a component of Medicare. If you're happen to be in an Advantage plan, the Part D plan is pretty much inside. It's basically inside the Advantage plan embedded in there. So you get a Part D plan with it, so you don't have to worry about signing up. For those who have a Medicare with a Medigap, by the way, Medigap and Medicare supplement are exactly the same. It's the difference between an automobile and a car. They're just the same. So
Medigap and Medicare.
Medigap and Medicare supplement are exactly the same.
Okay, that's good to know.
So people, whoever the confusion gods are out there, they said, okay, we just want to throw something in and mess with everybody's mind. So Medigap, Medicare, supplement, what. So they're exactly the same. But at any
Okay,
rate, if someone has a supplement plan, Medicare supplement or Medigap, then they have to have a separate standalone part, or need to have, let me say, a standalone Part D plan. You have after your A and B goes into effect, you have 3 months to sign up without any kind of penalty. There's a small penalty if you happen to wait over a period of time to sign up for your Part D, and that's explained in the Medicare and You book. Medicare and You. That's explained on page 77 and through 79 there. There's a formula. You have to follow that form. It's a little complicated formula. You have to follow that formula to see what your penalty might be. It's important to sign up really close to your Part A and B plan. So that is very, very important. So the thing about it is that you don't have to worry about this stuff this for the most part, because especially if you're on a supplement plan with a Medicare, it kind of works on its own by itself, its own self control, so to speak. And it's just a few things like the Part D and like the emergency room things that people need to be aware of, and just kind of keep it in their mind that if you happen to go to emergency room and you're checked into the hospital, you might not be eligible for the skilled nursing if you were to need it. So that's a little trip up that some people have. A few people, not all, but a few people. So it's just something to be aware of. And also the Part D plan. And by the way, you remember that we said you can call 1-800-Medicare. One of the ways that you can get your Part D set up is just call the 633 number that you just gave. You want to give it again?
it's 1-800-633-4227. That's
Right.
Medicare through our government. It's a Medicare. It's a free phone number, free call, 24 hours a day, 7 days a week. And does
Hmm.
that include holidays?
Yes, it does.
Oh, see there? There's that. Now,
When
Steve,
when I first found out about it, I said, Christmas? Yes, Christmas. New Year's?
oh,
Yes, New Year's.
okay.
Easter? Easter. They're all open. It's an amazing thing. But
It
just
really
a lot of
is.
people don't. A lot of people don't realize that. But and
Yeah,
the other
normally
thing
you
is, I
wouldn't call a number, especially our government, on a holiday.
right, right, and I found that if you call late at night, say a Central Time, or you want to do, you call, then someone is always available, and they're slow and they're receptive. By slow, I don't mean they're slow. They're just everything is calm and peaceful, and you don't hear a lot of conversations in the background. So I queried someone one time when I called them, and I said, "Why is it so quiet there?" She says, I work out of my home. I'm here at home. I have my thing all set up. All my computers are all set up, and so I said, "Wow, that is really something." And a lot of times when you call somebody in a call center or the information, or you hear all the racket and people laughing in the background, you had that experience, right? But but with Medicare, if you call in the off hours, you get the same person with all the right information. He or she has their computer all set up in their bedroom. Not I don't know, home office. Let's say home office. So that's a little thing that I discovered some years back.
Steve, I have
Kind
a
of
couple
interesting.
questions for you, if
Okay,
you don't mind.
sure.
So yesterday I was telling someone about your show and about Medicare. They're getting up there. They just turned 62,
Hmm.
and she said, I'm starting to consider, what's going to happen to me in the next 3, 4 years. And I said, oh, well, you need to call Steve Baker. You need to have his phone number ready to go, because when you have questions about Medicare, he's going to help you decide which program you is best for you. And you might as well get going on it now, because it's so confusing. You might as well start now, because I've known you for a few years, and I'm still just getting bits and pieces here and there, but it's starting to click in. So by the time I turn 65, I'll know. So their question to me was, well, I'm getting ready to sell my house and live in a motorhome and travel the country and do some
Uh-huh.
sightseeing while I'm still young. So
Uh-huh.
they're retiring from their job very soon,
Uh-huh.
and they're going to start preparing, putting things in storage and selling, and they're just really trying to take it easy and not do it, too fast.
Hmm.
And so she said, what happens if something goes wrong when I'm on the road? Let's say they have to be taken to the emergency room and they're in a different state.
Hmm. Well, you may recall in our earlier discussions that I've said there are two kinds of tradition with Medigap, Medicare supplement plan. Uh, the traditional pays 80%, and the supplement pays the remaining 20%. So the two work in tandem; they work together. So you really, for sure, need to have both of them together. And then there's the other plan, which is an Advantage plan. The Advantage plan is location specific. In other words, it needs to be the medical care needs to be provided in most of the cases needs to be provided in the county where they live, or for sure the state where they live. And the issue, if you happen to be traveling around a lot and you're carrying with you a Medicare Advantage card, because that could really trip things up. On the other hand, if you have traditional Medicare with a supplement, you can get services in any hospital. Now let me step back just a second. With the Advantage card, you can get immediate treatment in an emergency room. You're not ever going to be denied treatment. But once that's done, they're going to try to get you patched up and moved on out, and you get you back to where you belong, whatever state that is or whatever county that is. in order to have any kind of follow-up and that sort of thing. On the other hand, if you have the traditional kind with the supplement, all hospitals, every single one of them, will take the supplement with, will take the Medicare with the supplement. So it's you definitely need, if you're traveling around a lot in the country, you need to have a traditional Medicare with a supplement, and you can go to any doctor who takes Medicare, and most of the doctors do, and everywhere. You can find them all around. You can go to any emergency room. You can go to any hospital and get treated. Well, no problem. They'll go ahead and take the plan. So there's
Very
usually
good. Very
no
good. It
issues.
sounds to me like the Advantage plan is not the way to go. I'm trying not to.
Well, let's back up and say
Okay.
it's not. You can't say it's not the way to go, because every situation is different. Everyone's needs are different.
Right.
So both plans cover pretty much your both situations. It just depends on what your finances are and what you can afford and so forth.
And
But
that's where you come in and help them straighten all that out and try to pick the best plan for them, because every person is different. Every couple is different. Every
Yes.
state is different. And that's where
Yes.
you help them try to decide which is the best one for them.
Right, and the Advantage plan definitely fills a need for a lot of people. Let's put it that way.
Okay. All right.
So
Any other information we need to know about the differences in the hospital and the A and the B?
I think we've just covered that part of it. I just wanted to make sure that people understood these little things, little corners that you need to be aware of, and mostly you're going to be taken care of in an emergency room. But it's just good to have, you're comfortable with what you have. And in an Advantage plan, you normally have, there are two kinds of Advantage plans to confuse the issue more. There's an HMO and a PPO. And I don't have time right now to explain the difference between the two, but there is a difference. And one is just a little better than the other and so forth. But you can if you delve into it a little bit and you're comfortable with what you call your primary care provider, your PPO, then you're going to be in pretty good shape, and you're just going to have to go through a few more hoops and so forth, but you're going to get treated. The American healthcare system is, in my point of, my way of thinking, is the best in the world. My wife and I have been on Medicare for many years, and what I can do is I can draw on my own experiences, and this is what happened to us, and this is what happened to us when we went into the hospital, when we went to this doctor, or we wanted to change doctors and so forth. So I can relate my own experience. I've had a quadruple bypass. My wife has had cancer. I've had cancer. So, I can advise someone on the way to go for their particular situation.
I want you to know, if you're watching this on YouTube or on Facebook, or you're listening to this on a podcast, it doesn't matter how you're getting this information. I want you to be able to contact Steve or Medicare directly. And so I'm going to give the phone numbers out again, and another way to get a hold of Steve. So Steve has a really nice website. It's called bakerseniors.com. That's bakerseniors.com. And you can call him at 832-754-3292. And I want you to know that Steve is available to answer your Medicare questions about you, your family. Let's say you're a caretaker and you need some questions about how you're going to handle the Medicare. Like me, I gave Steve a nice referral to a lady who has Alzheimer's. Now, she couldn't handle the Medicare information herself, but her family member could. So if you are a caregiver, a family member, a neighbor, someone who's handling it for them, you feel free to call Steve to find out how to get them on Medicare or to find out if they have the right Medicare coverage. I think it's very important. We're live
Yeah.
here on YouTube, Facebook, and on your favorite podcast app every Tuesday morning at 8 a.m. Central. We want your questions. We'd love to have you on the show if you'd like to come on. But we really want to make sure you understand everything that there is to know, especially we don't want you to be surprised. Thank you, Steve, for all your information. You are very helpful, you're very clear, and you're very kind. So I know people want to reach out to you. Do you have any last words for us until next week?
Well, just real quickly, I would say just because someone calls me to ask a question doesn't mean that you're obligated to do business with me. A lot of people don't even need Medicare, perhaps. It's any all kinds of situations.
Right.
But free of charge. I'm more than glad to help and ask questions, answer questions rather about what they have. So if there's any
Fantastic.
confusion, just let me know, and I'll be glad to talk with you.
Fantastic. Thank you. Until next week, we'll see you then. Bye for now.
Bye.